Right here in studio, all to do with the fight against malaria in the country. Let's start with a few statistics, because in 2019, Kenya became one of the 3 countries to take part in the malaria vaccine implementation program, which was piloted and rolled out of the world's first malaria vaccine. By the end of 2021, the World Health Organization had actually recommended the use of the vaccine to prevent severe malaria in children under 5 years of age. Now, ahead of the World Malaria Day that is set to be commemorated on Friday this week, on the 25th of April, we evaluate the fight against malaria in the country. We'll be taking a look at the impact of foreign aid cuts and whether or not they will jeopardize the gains that have been made. Equally, what's the impact of the malaria vaccines in the country? Joining me in studio to have deliberations on this and much more is Dr. Damaris Matoke, who is a principal researcher at KEMRI, that's the Kenya Medical Research Institute, and she's equally the Deputy Director at the Biotechnology Research Program. Dr. thank you so much for your time. Thank you for making time. Karibu sana to KTN Prime.
Thank you. Thanks for having me.
Okay, let's start with the impact of the 2025 funding cuts, because between 2010 and 2023, the United States actually contributed an average of 37% of global malaria financing through bilateral and multilateral channels. And as we well know, the executive order by US President Donald Trump definitely did have an effect on USAID's financial support. Talk to us about the disruptions to health services that have been noted, especially in the fight against malaria in the country.
Yeah, for Kenya, we are heavily reliant on donor funding. There is domestic support, but donor funding has been the major contribution. 60% of the commodities, 60% of the fight against malaria in Kenya is externally funded. So with the current cuts, Kenya faces a shortfall of around 9 billion Kenyan shillings in implementing of the Kenya malaria strategy. And these cuts across from the diagnostics, because we get most of the diagnostics supported from Global Fund and other partners. There's a component around the drugs, therapeutics, management of the disease, treating cases as they are diagnosed. There's a component of the control of vectors. So use of the bed nets, use of the indoor residual sprayings, all this support now is facing a challenge. And these control mechanisms are the recommended ones from the WHO, and this support provides protection from children to the old age as far as the control of malaria is concerned. Therefore, with this shortfall, we go back. The gains that we've made might likely be affected if we don't think otherwise, think differently and start doing things differently.
And let's talk about doing things differently, because the challenge that Kenya and other African countries are facing after the budget cuts is all to do with becoming self-reliant and budgeting our own health budgets. Talk to us about the steps we need to take as a country in order to ensure that these budget cuts do not affect the fight against malaria, including other diseases here.
First of all, we have to start thinking around how do we mitigate against the 60% shortfall, which is external funding. If that is removed, then we are going back to the drawing board of where we were way back years, more than 2 decades of malaria infections. So how can countries like Kenya be self-sustainable? And this starts from domestic funding. How can we be able to invest in malaria locally, have our own financing systems, financing mechanisms, and this is from the national level to the counties to the communities, whereby we ensure that there is continuous funding for sustainability, so that when a donor withdraws, this does not. So domestic funding should be the first thing. The next thing is local manufacturing, having our own commodities produced locally, and also we buy and utilize those commodities. You realize most of the diagnostics come the drugs that we use are imported. If we are able to produce these things locally, that will be the perfect scenario, because this ensures there's access, continuous access, there's sustainability, and also actually affordability. Investing in the fight against malaria actually will help a country like Kenya be economically stable because of the investment that goes around the fight against this disease. If that is removed, then these sources can go somewhere else. So domestic funding, local manufacturing, but also supporting our own research. I come from Cambridge, where we do a lot of research, and our research is usually funded externally. We have to look for money from out there. How can government invest in the research and development? And this helps by ensuring there's innovations that are local, that are domesticated, that affect our own populations, customized to our own populations. And finally, how can we have solutions? Because climate change has become a big issue. So if we have funding that is able to fight these climate change, climate adaptations, so in the control against malaria, because recently I think you heard about coming up of a new species that is Anopheles stephensi. And this is supposed to change the scenario on how malaria is transmitted in the country. So if we don't have strategies that are local, that are fighting this vector, then that changes the situation of malaria in the country, and we'll be having more and more cases. Therefore, it's important that we get our own local innovations that respond to our local situation.
Okay, that's proper to note, and we'll be getting to the work KEMRI is doing in terms of research. But before that, mosquito-borne diseases are a global concern and disproportionately affect women and children under the age of 5. So how do we develop gender-responsive health programs that target some of these vulnerable groups? Talk to us about intentional inclusion of women and children in the fight against malaria.
For sure, women and children carry the highest burden of malaria in the country. So you find that even from the deaths that were reported in 2023, children, 76% of those deaths globally are from children. And women also are in this category of the population that is highly affected. So it's important that we look for solutions that are customized to this population, women and children. If we are able to have gender responsive, be it structures, systems that include women in the fight against this disease, it will be extremely important. It will bring positive change in the country. So in the communities, when we are rolling out tools, it's important that we ensure that women are part of the process. Women contribute. Their voices are part of the designing of tools, if tools are designed, because in a real scenario, is the women at home who actually ensure that the tools that we roll out, be it the bed nets, children sleep under them. They ensure that children, if you say they need to be diagnosed before they are treated, they're the ones who ensure that children are taken to hospitals, they are treated. The women are the ones who will ensure that the entire family is protected against malaria. Therefore, it's important that we customize it. We hear their voices, but we also have gender responsive solutions which accommodate women, be it needs how they put up in the households. When they're hung up there, will women manage to put them up? So when we design such kind of tools, we need to ensure that women are on board. Apart from that, it's important that women are part of the decision-making process. When decisions are made at higher levels, it's important that we bring these women on board so that they share as part of making decisions which are implemented at community levels. So gender responsive solutions are extremely mandatory and important if we're really serious about eradicating or eliminating malaria in Kenya.
Okay, let's talk about the world's first malaria vaccine that is currently in use in Kenya. And the Ministry of Health is expanding access to the vaccine in areas with high malaria transmission. What's the real impact of this malaria vaccine? Have we seen a decrease in mortality rates, especially in children?
Yes, the vaccine, currently we're using the RTSS. There's also the R21 matrix, which is cheaper and easily accessible. This vaccine is targeted to children. And in Kenya, we are rolling it. It's in moderate to high burden malaria areas, mostly Western Kenya and other regions where malaria cases are high. So these vaccines are expected to avert or reduce malaria cases, especially in children under 5. And the vaccines are implemented when children are 6 months old, 7 months old, 9 months, and also 12 and 24 months. So the idea is that since we are seeing many children, as I said, 76% of all deaths reported are children, it's expected to actually reduce that by 30% and below. Yes.
Okay, that's definitely a step in the right direction.
Yes.
So from where you sit, in terms of the goal of malaria elimination by 2030, are we on course?
Based on the WHO report about cases in 2023, we were on course previously, but the report now indicates that we have stalled. We have stalled, we have stagnated.
Okay.
Therefore, this is extremely dangerous. It's not a good sign for us, which means then it's important that there's reinvestment or re-strategizing and innovations coming on board as far as control is concerned. However, I could say that there's been success. We've been seeing a decline in cases, but since I think I could say 2021, the decline is not as expected. In 2023, there's stagnation. Okay. We don't know what 2024 report will be saying, and 2025. We could, if we don't think differently or do things differently, we might just stagnate or actually decline. The success might be not be sustained. So I could say, yes, we should be on course, but unfortunately, we are not on course.
Okay, let's talk about KEMRI, because for the last 30 years, KEMRI has been at the forefront of groundbreaking malaria research, significantly improving treatment and prevention strategies that have been recommended by the World Health Organization. Talk to us about the research that you're doing at KEMRI and how it plugs into the broader strategy of the fight against malaria.
KEMRI has been at the forefront again in the fight against malaria, I think, since its establishment in 1979. And we do research on malaria from different platforms. Here we're looking at tackling malaria from the infection. We call it our hosts, where we do surveillance, trying to understand people who are infected population. We look at diagnostics, coming up with the novel diagnostic tools that can actually target our population, because some of the diagnostics have been reported to miss out, whereby someone is positive but a diagnostic report's negative. So KEMRI does research around diagnostics. KEMRI has been doing research around vaccine. Actually, KEMRI was part of the organization that was part in researching this current RTSS vaccine that is rolled out in the country, and our report informed WHO in its implementation. We actually also do what we call as vector surveillance. We do surveillance of the mosquitoes, trying to support Ministry of Health, the National Malaria Control Program, who is the main bearer of routine surveillance of the disease. So KEMRI comes in on board to support routine surveillance, where we currently survey over 30 counties in the country, and we provide that data for information. So we are the ones who report where the species are, where the transmission hotspots are, and what should be done in that. We also do research around new intervention, new tools that can be used in the control, and we've been part in the process of evaluating new nets that come on board, especially nets that currently are being implemented to fight against resistance, insecticide resistance. So KEMRI is part of that process. KEMRI also actually supports highly in the drug drug efficacy studies, and this data is the one that informs the country on which drugs should be registered, on which drugs should be utilized by our population. And KEMRI, finally, I could say that we've been part and the process of this malaria in pregnancy, trying to do research to understand malaria in pregnancy, and finally looking at therapeutics, drugs, traditional medicine research, drugs that can be implemented in the country. Holistically, KEMRI is part and parcel in the fight against malaria from all kinds of fronts, from the vector, from the parasites, that's Plasmodium, and also to community engagement, but also social mobilization and behavior awareness.
Okay,
yes.
Let's talk about community engagements, because on Friday, the world will be celebrating or commemorating the fight against malaria on the World Malaria Day. Well, how exactly can Kenyans plug into this conversation, into this ongoing efforts to ensure that Kenya is malaria-free? Yeah.
Actually, our slogan, or what we're saying, is that malaria, the fight against malaria starts with me. And also malaria, the fight also starts with you and starts with all of us. So communities are part and parcel of this process. And I'm a community, even though I'm a researcher. So community needs to be involved. We need to involve everyone, from a child, from school-going children to the youth. Actually needs to be the ambassadors in the fight against malaria, and their programs that are targeting the youth. We talked about women. We also need to talk about the household, the heads of households, because they're the ones who are decision makers at household level on what needs to be done. We also need to include or involve leaders at communities. Those, the heads of the communities, Nyumba Kumi, those leaders, the chiefs at community levels, but also come to the counties overall, work with the community health workers. So the community needs to be the, can I call it, the bearer of the fight against malaria, because we cannot succeed without the communities being at the forefront in the fight against disease, because implementation of tools, control strategies, implementation of the any solutions that come up, be it from the research, be it from the policy level, it's the communities that take up this. So it's a must, or it's necessary that communities own this process. Ownership should be from communities for us to succeed.
And as we finalize, is there goodwill from the government? A lot of times people say that in terms of policy, we're one of the best. But when it comes to implementation, we lack in one way or the other. So is the political goodwill there in the fight against malaria?
I could say the political goodwill is there. Actually, we couldn't be where we are without the support of the government.
Okay.
So the political goodwill is there. But what we need to see more investment. The talk is there. There are various initiatives, I could say, in country, from having the youth corps, from having the leaders, soldiers. It's important that now we invest. Apart from just talking and having good documentation, let us have clear investments in the fight against malaria. One of the things I need to say is that malaria is a preventable or beatable disease, we could say. But it cannot be done without investment, and investment in a way that is innovative, not just normal, oh, this is the amount of money we're giving. No, but with innovative investments in the fight against this disease.
They say you're only as strong as your weakest link. Well, what's the weak link in this fight against malaria?
The weak link in the fight against malaria, I could say that it's more on who runs, can I say, who runs the show. We've seen very strong leadership that has been there in the fight against this disease. But if a leader is not supported, then you find that they get frustrated and drop. So let's support our leaders, be it from national levels to county levels. The leaders need to be supported, so when they champion a process, it's important that we provide that support. But I could say, and I go back to investment, resource mobilization, provision of resources. That's where we have a challenge. Now with the withdrawal of some of the funding, we are actually going to face challenges as far as the fight of this disease is concerned. We might go back where we were decades back.
Yes. And we wouldn't want a scenario where patients are forced to go into their pocket in order to get the much necessary treatment or vaccines against malaria. That would be taking 5 steps backward, you know.
Even 10 steps, yes. Yeah. Yes. So we need to ensure that even when we put programs, that the insurances programs ensure that malaria is not a problem. As far as when a case reports to the hospital, they are managed and commodities are available. Honestly, commodities will be a challenge, from diagnostics, as I said, and drugs. If the current funding that has been withdrawn is not replenished from somewhere. So we need to come back together and ensure that commodities do not become an issue. There's no gap there. And this also supports from nets provision, because nets have really contributed a whole lot. Spraying of the houses, all those interventions, we ensure that at least the bare minimum are met.
Okay, thank you so much for your input right here on KTN Prime. Of course, it's an ongoing conversation, bearing in mind that World Malaria Day will be marked just this Friday. So we sort of jumped the gun and set the pace for the fight against malaria and the celebrations that will be held on Friday. Dr. Damaris Matoke is Deputy Director at the Biotechnology Research Program. She's equally a Principal Research Scientist at KEMRI, just joining us in studio to help us deliberate on the steps we need to take as a country to perhaps fill in the funding gaps we're experiencing due to the freeze on USAID funding, and equally the vaccine, which is mentioned, is doing tremendously well, especially in the malaria-prone areas of the country. Looking forward to more deliberations on this very important matter. Asante sana. Okay, that's how we wrap up tonight's edition of KTN Prime. I hope you're adequately informed. My name is Jesse Rogers. On behalf of the entire team, including our sign language interpreter, Pretty Janet, we say good evening. Enjoy the rest of your viewing. Good night.